The majority of breast cancers are sporadic. That means that they are not caused by genes, they're probably caused by our environment or something else that we still don't know what it is. However, around 30% of breast cancers are caused by genes, and we divide them into two different categories. The familial category, which means that they run in families, and then we divide them into the hereditary category, meaning that we actually have certain genes that we have found that are responsible for these breast cancers. When we look at the genes that can be responsible for causing breast cancer, there's two specific genes that cause the majority of breast cancers, and those are BRCA1 and BRCA2 genes. And those can cause anywhere between 30 to 70% of the hereditary breast cancers. There are other two genes that are much more rare. One of them is P53, causing a syndrome called Li-Fraumeni that can again increase the risk of breast cancer, and another gene called P10 that can cause a syndrome called Cowden's disease that again can predispose women to getting breast cancer. And then there's another 30 to 70% of genes that we still haven't found that we know that can cause breast cancer. When we look at who to test and when we see patients at our cancer genetics program, we look at their family history and their personal history. We look at women that were diagnosed with breast cancer at a young age, young meaning under the age of 45. We look at women that have had two breast cancers, women that have had histories of breast and or ovarian cancer in the family. And then we also look at Ashkenazi Jewish women because they can have a higher prevalence of those BRCA1 and BRCA2 genes. Male breast cancer is also something that raises a red flag for us. Men that have breast cancer usually are recommended to have genetic testing. And the genetic testing is a pretty simple process. It involves just a blood test. Individuals that carry a BRCA1 or BRCA2 mutation have a higher risk of getting breast cancer and ovarian cancer. The things that we can do to help them are offer them breast exams when they're much younger, offer them mammograms starting at the age of 25, MRIs starting at the age of 25, and in that way we can actually identify cancers earlier and we can cure them. As far as ovarian cancer, things are a little bit difficult because we don't have surveillance techniques to catch ovarian cancer early, so we rely on taking the ovaries out in women that have finished having children, and that would be our only way of preventing ovarian cancer. One of the major concerns of people that come to see us for genetic testing is, what if insurance companies get the test results? What happens? Do they get denied coverage, or do they get their premiums increased? And thankfully, we actually have both state and federal laws that prohibit insurance discrimination. The federal law is called the GINA law, and it is the Genetic Information Non-Discrimination Act that was signed in 2008, and that prohibits any discrimination based on genetic testing, both for health insurance as well as for employers. So employers cannot discriminate against employees based on genetic results. In most cases, insurance companies pay for genetic testing. A lot of insurance companies, including Medicare and Medicaid, have specific criteria that they use to either deny or agree to pay for the genetic testing. That testing may not be very cheap. It can cost even more than $3,000. So we work with insurance carriers, and in most cases we're able to get the test paid for. In cases where the genetic testing is not really paid for by the insurance companies, then the individual may have to pay for the testing. I always encourage patients to be proactive. It is their health, and regardless of how much their physician wants to take care of them, sometimes they forget. So they should be proactive and ask whether they qualify for genetic testing and genetic counseling. And they should do that themselves, even if their physicians do not tell them that they should go for genetic testing. We recommend that when we do genetic testing, we also include genetic counseling. The counseling session is around 1 hour long. It involves a genetic counselor that really explains what the testing involves. It explains what we do with the results and how we interpret the results. And that's very important for the patient to understand before she undergoes a genetic test. We have our cancer genetics program at Northwestern University, and we see our patients together with the genetic counselor, and then we counsel them on whether they should or should not get testing done.